Thanks for watching. This is YouTube Medical University. I'm recording this video urgently. Mr. Iwai, who is famous from Rewa no Tora, announced on his social media that he has lung cancer. Many of you may not be very familiar with what kind of illness lung cancer is. You may believe it only affects smokers or makes you cough up blood. I think many people have that kind of knowledge, but actually that's not always the case. There are many people who get it even if they don't smoke, and the symptoms themselves can be quite varied. Symptoms can appear on the hands or face, with many signs that are easily missed. And with lung cancer, it's easy to miss those symptoms, or sometimes there aren't any symptoms at all, so it's actually the #1 cause of cancer-related deaths. Among all cancers in Japan, it's the leading cause of death. In terms of frequency, it's said that about 1 in 17 men and 1 in 48 women will develop lung cancer. And it's often discovered after it has already progressed. About 40% of people are diagnosed when the cancer is already advanced, so by the time it's found, it has often progressed and metastasized, making surgery impossible in many cases. In fact, when I see patients in outpatient clinics or during home visits, I often encounter lung cancer cases. Lung cancer is really troublesome because by the time it's found, it's already advanced. Even when I refer patients to a respiratory specialist, unfortunately, surgery is often not possible. There are many cases where patients undergo chemotherapy, but as their physical strength declines, even chemotherapy becomes too difficult, and they end up spending their final days at home receiving palliative care. That's why I made this video, so that people won't regret thinking, I never imagined these symptoms could be lung cancer. In the latter half of the video, be aware that these symptoms exist, including some unexpected ones. To detect it early, current cancer screenings, I would actually like to recommend a certain test over the standard tests. So in order to find lung cancer in the first place, and to detect it early before it develops, before any symptoms appear, I'll explain in this video what you should do. Please watch until the end if you're interested. Here at YouTube Medical University, we provide knowledge about diseases, including prevention and early detection tips, all shared from a doctor's perspective. I'd appreciate it if you subscribe to the channel so you don't miss new videos. Now, let's get started with lung cancer. Many people think that lung cancer is mostly found in smokers, but that's actually not the case. In fact, there are cases where people who don't smoke and where tobacco isn't involved. When it comes to lung cancer, actually, about 30% of cases in men are not related to smoking, and for women, it's about 80%. Most cases in women develop without any connection to tobacco. So, I think you can see now that this isn't just someone else's problem. And what's more, it's said that people who smoke have 4 to 5 times the risk, so of course smoking itself is a risk. But just because you don't smoke, it doesn't mean you're completely safe. Thinking you don't need to get tested or assuming that any symptoms you have must be something else is actually quite dangerous, in my opinion. There's a concept known as the 5-year survival rate. It's a statistical figure that shows the probability of surviving 5 years after being diagnosed with that cancer. If it's discovered at stage 1, which is relatively early and surgery can be performed, that person has a 90% 5-year survival rate, meaning 90% live at least 5 years. So this means the prognosis is quite good. However, as I mentioned earlier, if the initial symptoms are missed, or if there are no symptoms at all and it's hard to detect and it's found at stage 4. At the advanced stage, the 5-year survival rate is only 5%. You can see how much it drops. That's why you can understand how important it is to detect lung cancer early. In the second half, watch for these lung cancer symptoms and be careful. Surprisingly, facial, hand, or neurological symptoms can also indicate lung cancer, so let's review them one by one. I'll outline the main warning signs of lung cancer in 4 categories. First, symptoms resemble a cold. Coughing is one example. Coughing up blood is a clear warning sign. One of the well-known symptoms of lung cancer is coughing up blood or having blood when you cough, but it's also common to just have a persistent cough. Actually, among the symptoms of lung cancer, the most common one is coughing. It's said that about 70% of people with lung cancer have a cough, so it's something to watch out for. But in reality, not many people go to the hospital suspecting lung cancer just because they have a cough. What that means is, when you catch a cold, you also get a cough, so it's hard to tell the difference between a cough from lung cancer and a cough from a cold. So, when should you start considering lung cancer if you have a cough? Generally, with a cold, a cough lasts about 2 weeks, or at most around 4 weeks, and then it naturally goes away. However, with lung cancer, once it develops, the chances of it shrinking and disappearing on its own are almost zero. So gradually, the symptoms get worse. So if your cold symptoms, meaning your cough, continue for 2 or 4 weeks, that's a sign you should suspect lung cancer. And as I just mentioned, since lung cancer itself gradually grows larger, worsening symptoms are also a sign to suspect cancer. In fact, if your cough gets more frequent or stronger after 1 or 2 months, you should suspect lung cancer in such cases. And the absence of other symptoms is also an important sign that increases the likelihood of lung cancer. Normally, when you catch a cold, you have symptoms like coughing, a runny nose, and a sore throat, right? However, when it comes to lung cancer, the cough caused by lung cancer is due to the cancer irritating the airway, so the cancer itself doesn't attach to the throat. That's why you rarely have symptoms like a sore throat or a runny nose. So if you have an unusually persistent cough without other cold symptoms, it could be a sign of lung cancer. Please be sure to pay attention to this. Other than that, tuberculosis can also cause a persistent cough. Tuberculosis used to be quite common in Japan, so that's another possibility. In any case, whether it's tuberculosis or lung cancer, a cough that lasts a long time could mean there's a serious illness hiding, so please make sure to see a doctor. If you have a regular doctor, you should see them first. If you don't have one, you should visit a local doctor who specializes in respiratory medicine. That's likely the best approach. Yes, it can also narrow the airway, causing coughing and possibly coughing up blood. Also, as the airway passage gets narrower, you might feel short of breath, or when you breathe out, you might wheeze or make a whistling sound, almost like asthma, or you might cough and hear a wheezing noise. These kinds of symptoms can actually be signs of lung cancer, so if any of this applies to you, please consider seeing a doctor. Now let's move on to the next symptom. I've written nerves here, but what this means is something called a Pancoast tumor, which is a bit of a technical term. It's when cancer develops at the top part of the lung, called the apex. There are nerves running around this area, like the nerves that go to your arm. So when the cancer invades these nerves, it can cause symptoms like numbness in the arm. Also, there's something called ptosis, where the nerves in the face are affected, and as a result, one eyelid may droop. Other symptoms include sweating and various other nerve-related symptoms. You might not expect that symptoms like numbness in the arm, drooping of the eyelid, or sweating could actually be signs of lung cancer. You wouldn't think that, would you? In some cases, there's something called Horner's syndrome, where the pupil, the black part of the eye, can dilate or constrict, and some people have found that increased sensitivity to light was actually a sign of lung cancer. So there are quite a few unexpected signs. That's why, if you ever feel like something's a bit off, after listening to today's video, if you notice any symptoms later on, you might think, wait, could this be lung cancer? If you can remember that you had these kinds of symptoms, it can lead to early detection, so please keep this in mind. That being said, many of these symptoms are quite difficult to notice, so if you feel even a little bit off, I think it's best to visit a hospital. Also, it might be even better if you listen to this repeatedly and take notes, so you don't forget. And the third symptom is this, swelling of the face. It's a symptom where your face becomes puffy. Swelling has many causes. When your kidneys or heart aren't functioning well, fluid can build up or blood flow can stagnate, which often causes swelling throughout the body, especially in the legs, since gravity makes them more prone to swelling. However, swelling caused by lung cancer is different. Sometimes your face can become swollen. Let me explain what this means. This tends to happen when lung cancer develops on the right side. Some of you who are health conscious might already know this, but we have a large vein running on the right side of our body. Depending on where the lung cancer forms, it can press against this vein and narrow it. Normally, blood that goes up to the head returns through this vein on the right side, but if lung cancer is present here and gets in the way, it becomes harder for the blood flow to return. As a result, the blood flow gets congested, which leads to swelling in the face. Isn't it easier to understand if you know the reason? Face swelling by itself is uncommon. Allergies may cause it, but if only your face is swelling abnormally, this symptom could actually be a sign of lung cancer, so I think it's good to be aware of it. Alright, so the fourth symptom is what's called clubbed fingers. Have you ever heard of clubbed fingers? Normally, fingers are shaped pretty straight like this, but when we talk about clubbed fingers, it's like the sticks used for drums. Just like drumsticks, the tips of the fingers around the first joint become swollen and enlarged. That's what's called clubbed fingers. Please try searching for clubbed fingers on Google or something. This is also actually said to be a sign of lung cancer. As for how many people with lung cancer have clubbed fingers, it's said that about 17% of people with lung cancer have clubbed fingers. So, just because you have clubbed fingers doesn't necessarily mean you have lung cancer, but clubbed fingers themselves can be a sign of various diseases, such as lung cancer or interstitial pneumonia, which is a type of pneumonia, and other conditions. I think it's very important to consult a hospital and undergo various tests as soon as you notice clubbed fingers. Yes, so since it can be quite difficult to tell whether you have clubbed fingers or not, I will introduce a simple test called the Shamroth sign. Please try placing your first joints together like this. When you look closely, can you see the space between the first joints? It's a bit out of focus, but you can see there's a gap like this. You see the gap, right? Having this gap is considered normal. You should generally see a diamond-shaped, vertically long gap here, but for people with clubbed fingers, the area around the nail is raised, so this gap doesn't form. This is called the Shamroth sign, so if you're watching this video, please try it yourself, and if you notice anything unusual or feel something is off, see a doctor at the hospital. That's a brief overview so far. What kind of disease is lung cancer? One of its characteristics is that early symptoms are hard to notice, and sometimes there are unexpected early symptoms, or even no symptoms at all. Because of this, you might wonder how lung cancer is detected if there are no symptoms. That's where testing comes in. Actually, there are various tests for lung cancer, but compared to general cancer screenings, there's a particular test that I personally recommend. So, at the end of this video, I want to explain how to detect lung cancer at an early stage. At YouTube Medical University, we share data-based information from a doctor's perspective and take full responsibility. We provide medical info, health tips for immediate improvement, and disease prevention advice. If you don't want to miss our new videos, please subscribe to the channel. It really encourages us. So, let me get straight to the point. What I believe is important for the early detection of lung cancer is a test called low-dose computed tomography. Low dose refers to the amount of radiation exposure. It means the radiation dose is kept low. It's a computed tomography scan. Do you know what that is? You lie on your back and enter a donut-shaped ring, which moves you in with a whirring sound. It slices your body and examines each cross-section closely. That's what the test does. Now, before I explain why I recommend this test, do you know what kind of lung cancer screenings are currently done in Japan? Lung cancer screening is, of course, a very important test. Just how important is it? Well, in Japan we have what's called organized cancer screening. The government officially endorses 5 types of cancer screenings and even covers the cost, so everyone is encouraged to get them. Lung cancer screening is one of these. By the way, the 5 are lung cancer, stomach cancer, colon cancer, cervical cancer, and breast cancer. These 5 screenings are the ones you should definitely get. By doing them, you can detect cancer early and reduce the mortality rate. Since these benefit public health, the government will pay for them. This is what we call organized cancer screening. On the other hand, other cancer screenings, like for prostate cancer, ovarian cancer, or pancreatic cancer, are not included in organized cancer screening. That's why, since these don't show a reduction in mortality that matches the cost, the government doesn't fund them. In other words, it's better to have lung cancer screening, but the tests used for lung cancer screening are X-rays and sputum tests. By collecting sputum and taking x-rays, we check if lung cancer appears on the x-ray or if there are any cancer cells in the sputum. However, x-rays often miss things, especially with lung cancer. If lung cancer forms on the lung periphery, it's easy to spot on an x-ray, but it's harder to detect if it develops in the lung hilum. Actually, it's easy to miss because of the shadow of the heart. Since lung cancer in the center is close to the airway, cancer cells are more likely to appear in the sputum. That's why we do a sputum test, examining the sputum under a microscope to check for cancer cells. However, the chances of detecting it this way aren't very high. When we talk about evidence in research like this, there's no data showing that cancer screenings like X-rays or sputum tests reduced mortality rates. So even if you do them, we can't guarantee your future mortality rate will decrease. When it comes to this low-dose computed tomography scan, the mortality rate actually dropped by 20% compared to regular X-rays. That's what they say. So, there is solid data to support it. The United States Preventive Services Task Force, which seriously studies preventive medicine, there is a committee for that, and even there, this low-dose computed tomography is recommended. But with computed tomography scans, there's radiation exposure, so some people might think it's dangerous to have too many. That's why it's low dose. And when it comes to low dose, radiation exposure is just 1/10 that of a regular computed tomography scan. It's kept quite low. This dose is said to be about the same as a barium test. It's really quite low. Some people even have barium tests every year for stomach cancer screening. So even for people who actually have these kinds of symptoms, and even for those who don't, and especially for smokers, the risk increases by 4 to 5 times. After consulting your doctor, you might consider doing it annually. It might be a good idea to consider getting this low-dose computed tomography scan. In that sense, I basically don't really recommend getting a full medical checkup, but when it comes to this low-dose computed tomography, I do think there are benefits to getting it. Of course, it's also important to get regular lung cancer screenings. It's affordable, which is great. If anything is found, you can get a computed tomography scan at the hospital covered by insurance. But that's not always easy. I think it's very important to consult with your primary care doctor about checking for lung cancer or to get a low-dose computed tomography scan during a health checkup. I believe this is a very important cancer prevention measure. Originally, X-rays and sputum tests were developed in Japan to eradicate tuberculosis when it was widespread, so computed tomography scans were not performed. So, what did you think? This time, we talked about how lung cancer has a high mortality rate, is often discovered at an advanced stage, and that it's not only caused by smoking, it's also an important cancer for people who don't smoke. And since there are various symptoms, it's easy to overlook, so I introduced a variety of symptoms. And I explained that, above all, even if you don't have any symptoms, it's important to get low-dose computed tomography scans and regular cancer screenings in order to detect cancer early. If you like this video, please hit the like button, or even the dislike button. Any feedback helps us improve our next videos. And in the comment section, let me know if you have any symptoms. My doctor told me this. I'd like to try out this kind of test. If you have any thoughts like that, leaving a comment might be helpful for other viewers as well. Like I said, you can't just become healthy overnight. I'm sharing these videos from a doctor's perspective, so please subscribe. Few viewers are subscribed, and I'd like to raise that number. I want to increase the number of people who are mindful of their health on a daily basis, so I appreciate your support. See you in the next video.